In this video by DecPlate, we will understand the VA rating for irritable colon syndrome, amebiasis, bacillary dysentery, ulcerative colitis, intestinal or hepatic distomiasis, chronic enteritis, chronic enterocolitis, and diverticulitis conditions. Disclaimer: this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Irritable colon syndrome, amebiasis, bacillary dysentery, ulcerative colitis, intestinal or hepatic distomiasis, chronic enteritis, chronic enterocolitis, and diverticulitis are gastrointestinal disorders that can be linked to military service due to stress, exposure to pathogens, and harsh environmental conditions, impacting veterans' digestive health and overall well-being. Irritable bowel syndrome, IBS, diagnostic code 7319. A chronic gastrointestinal disorder characterized by abdominal pain related to defecation, occurring at least 1 day per week over the past 3 months. Additional symptoms include changes in stool frequency or form, altered stool passage, straining or urgency, mucorrhea, abdominal bloating, or subjective distension. Depending on the severity and frequency of symptoms, IBS can be rated by the VA as follows. 30% rating. Recurrent abdominal pain related to defecation occurring at least weekly over the past 3 months. Additionally, 2 or more of the following symptoms are present: change in stool frequency, form, altered passage, straining or urgency, mucorrhea, abdominal bloating, or subjective distension. 20% rating. Abdominal pain related to defecation experienced for at least 3 days per month in the last 3 months. Alongside 2 or more of the following symptoms: change in stool frequency, form, altered passage, straining or urgency, mucorrhea, abdominal bloating, or subjective distension. 10% rating. Occasional abdominal pain related to defecation occurring at least once in the past 3 months. Plus 2 or more of the following symptoms: change in stool frequency, form, altered passage, straining or urgency, mucorrhea, abdominal bloating, or subjective distension. Note: this code covers functional digestive disorders like dyspepsia, bloating, constipation, and diarrhea. Evaluate additional symptoms under the relevant diagnostic code, such as gastrointestinal dysmotility syndrome, diagnostic code 7356, following guidelines in section 4.14 and this section. Amebiasis, diagnostic code 7321. Amebiasis is an infectious disease caused by the parasite Entamoeba histolytica. It commonly affects the intestines and can lead to symptoms such as diarrhea, which may contain blood, stomach pain, and cramping. In severe cases, it can cause liver abscesses and other complications. Amebiasis spreads through contaminated food or water and is prevalent in areas with poor sanitation. Treatment involves antimicrobial medications. Bacillary dysentery, diagnostic code 7322. Bacillary dysentery, also known as shigellosis, is an intestinal infection caused by Shigella bacteria. It is characterized by severe diarrhea, often with blood or mucus, abdominal pain, fever, and tenesmus. Transmission occurs through contaminated food or water and person-to-person contact. Treatment includes antibiotics and rehydration therapy. Colitis, ulcerative. Diagnostic code 7323. Ulcerative colitis is a chronic inflammatory condition affecting the colon and rectum, causing symptoms like abdominal pain, diarrhea, and rectal bleeding. It is typically rated as Crohn's disease or an undifferentiated form of inflammatory bowel disease, diagnostic code 7326, for VA disability purposes. Distomiasis, intestinal or hepatic, diagnostic code 7324. Distomiasis, also known as fascioliasis, is an infection caused by the parasitic liver fluke, typically Fasciola hepatica or Fasciola gigantica. It affects the liver, hepatic, or intestines, intestinal, leading to symptoms like abdominal pain, fever, and jaundice. Diagnosis involves stool tests and imaging, with treatment usually involving antiparasitic medications. Enteritis, chronic, diagnostic code 7325. Chronic enteritis is the long-term inflammation of the small intestine, leading to symptoms like abdominal pain, diarrhea, and weight loss. It is rated as irritable bowel syndrome, diagnostic code 7319, or Crohn's disease, or undifferentiated inflammatory bowel disease, diagnostic code 7326, depending on the predominant disability. Crohn's disease or undifferentiated form of inflammatory bowel disease, diagnostic code 7326. Crohn's disease is a chronic inflammatory condition of the gastrointestinal tract, which can affect any part from the mouth to the anus. Undifferentiated inflammatory bowel disease, IBD, refers to cases where the inflammation does not distinctly fit the criteria for Crohn's disease or ulcerative colitis. 100% rating. Severe IBD unresponsive to treatment, requiring hospitalization at least once per year, resulting in inability to work or characterized by recurrent abdominal pain with at least 2 of the following. 6 or more daily episodes of diarrhea, rectal bleeding, recurrent rectal incontinence, or abdominal distension. 60% rating. Moderate IBD managed with immunosuppressants or biologics on an outpatient basis, characterized by recurrent abdominal pain, 4 to 5 daily episodes of diarrhea, and intermittent signs of toxicity such as fever. Tachycardia, or anemia. 30% rating. Mild to moderate IBD managed with oral and topical agents, characterized by recurrent abdominal pain with 3 or fewer daily episodes of diarrhea and minimal signs of toxicity. 10% rating. Minimal to mild symptomatic IBD managed with oral or topical agents, characterized by recurrent abdominal pain with 3 or fewer daily episodes of diarrhea, and no signs of systemic toxicity. Note: after a colectomy or colostomy with ongoing or recurring symptoms, rate under either diagnostic code 7326 or diagnostic code 7329, large intestine resection, whichever gives the highest rating. Diagnoses under diagnostic code 7326 must be confirmed by endoscopy or radiologic studies. Inflammation can affect the small bowel, ileitis, large bowel, colitis, or any part of the gastrointestinal tract, from the mouth to the anus. Diverticulitis and diverticulosis. Diagnostic code 7327. Diverticulosis involves the formation of small pouches in the colon wall, while diverticulitis occurs when these pouches become inflamed or infected. Diverticular disease requiring hospitalization for abdominal distress, fever, and leukocytosis with complications like hemorrhage, obstruction, abscess, peritonitis, or perforation is rated at 30%. Without these complications, it's rated at 20%. If asymptomatic or managed by diet and medication, it's rated at 0%. Note: for colectomy or colostomy cases, apply either diagnostic code 7327 or diagnostic code 7329, large intestine resection, selecting the one that provides the higher evaluation. Thank you for watching this video. Please don't forget to subscribe and like our videos.